Welcome to Your Family's Health. This is Dr. Jeanine Cook-Gerard, and I'm from the nursing department here at Nassau Community College. Your Family's Health is a program that focuses on healthcare issues and resources available here in Nassau County. On the show, we will be speaking to experts from around the country to keep you up to date on current healthcare issues and trends. Today, we'll be speaking to Stephen Conenna about his book, Use Your Mind to Heal Your Body, a riveting book. So if you want to know more about how to stay healthy in Nassau County, stay tuned for the next half hour to the voice of Nassau Community College, 90.3 WHPC. Welcome to the show, Stephen. Can I call you Steve?
Absolutely. Call me Steve.
Wonderful book, and thank you for writing it. And can you tell the audience a little bit about who you are? You are a professional engineer and graduate of Columbia University.
Yes, that's right.
So tell us some more about you.
Well, I was born in Buenos Aires, Argentina, from an Italian background, and I was 2 years old when I came from Argentina. So I mentioned that because I love that part about my life, this multicultural background, and I just have a love of all kinds of people, no matter what backgrounds they come from. So, and that's part of the reason that I wrote this book, because of my experiences. I want to make sure that what I went through is able to help people from all over the world in all walks of life.
So, as an engineer, Stephen, tell me, how did you get to writing a book about using your mind to heal your body?
That's a great question. And the short answer is because I'm a patient. Mm-hmm. So or a former patient. As a civil engineer, I've worked on roads, bridges, buildings. I studied engineering, obviously, as a civil engineer. So in my junior year of college, I started to experience back pain. So that's kind of a significant a milestone for me, but it also starts to put the pieces of the puzzle together, because under the intense stress of an engineering program at an Ivy League school and those types of pressures, you can start to look back at some of the correlation between my emotions and the pain that I started to have. So eventually, while I was in my 30s working on a construction business that I had started, I lifted a piece of concrete. The pain came and never went away for 2 years.
Did you seek medical help for the pain that you were experiencing?
Yes, of course. You know, as a good engineer, the first approach as a linear, logical thing is to go see a back doctor. And so they do a physical exam, and before you know it, you're out taking all kinds of medications, physical therapy, and none of that stuff worked. So after doing, trying the rigorous medical Western medicine approach, I said, well, let me try a chiropractor. That didn't help. I said, well, what else can I do? I tried acupuncture with electricity through it. I tried a shiatsu massage. I even as an engineer, thinking logically, if there's pressure on my spine, maybe if I hung myself upside down. I don't know if you, Jeanine, remember those gravity inversion boots? I used to hang myself upside down, and I was hoping that it would, alleviate the pressure on my spine, but nothing seemed to work.
So I can understand when you're talking about this kind of pain in your back. So many Americans experience back pain, and it does alter your activities of daily living and how you live.
Absolutely.
So tell me how you came to write the book. What did you learn to bring you to the point where you said, okay, I'm going to write this?
Yeah, that's a great question, because as I tried all these different types of modalities to get better and nothing worked, I was really on the verge of having back surgery. And it was really at most of my friends and family who had seen the way I was before the pain, physical, active, mobile, and then saw me how I was during the pain for 2 years, limping, bent over, listed, to the side, suffering. They said, you have to do something about it. Please get the surgery.
Yeah.
But I had spoken to many people who had surgery. And yes, some people got better, but some people didn't get better. and some people got worse. So I was very didn't want to do the surgery.
Yeah.
So I remembered at this point, this is 2 years into the pain cycle, some research that I had done. This was because the first thing I did as a good engineering student.
Logical.
Is go
Very
to the
logical.
bookstore.
Yes.
And read up on as much back information as I can possibly get my hands on. And 99% of the information I got from bookstores or even college libraries, like here at Nassau Community College, was all pointing to the structural diagnosis, that there's a herniation in the disc, a disc abnormality. It's impinging on the sciatic nerve. The sciatic nerve is going down the leg. The sciatic nerve is inflamed. And so that's the cause of the problem, and that's what needs to be addressed. Except that none of these techniques that were addressing the supposed quote-unquote cause of the problem were working for me.
Okay.
So at this point, on the verge of having surgery, I said to myself, am I sure that I've turned over every stone before doing this? Mm-hmm. And at that point, it was kind of like a miracle. Just a light went off in my head. And I remembered a book that I had read early on in my research. And it was a thin little book that the name of it was The Mind Over Back Pain by Dr. John Sarno. Mm-hmm. And in this book, now I want to be careful about the way I say it. The first time I had the book in my hands, I actually misread it. I skimmed through it, and I said to myself, this guy is crazy. He's saying the pain is all in my head, and that's imaginary. So I threw the book down, and I said, what kind of garbage is this, and who would be foolish enough to buy it? Fast forward to 2 years, I'm at my wit's end, nothing worked, and I said to myself, maybe I misread that book. Let me see if I can go back and see. Something sparked my curiosity about that book again. Mm-hmm. So I went back to it, and this time I read it. And Dr. Sarno was not saying that the pain was imaginary. He was saying the pain is one of the most real symptoms in medicine, but it's a symptom. The cause of the pain is not structural, it's emotional. Mm. And that, from that moment on, my whole focus completely changed. Instead of looking at this thing structurally, like all the doctors, physical therapists, chiropractors were looking at the structural, I now started to look at it from an emotional perspective.
So, Steve, would you say, so this is what you mean by psychosomatic pain, that it's coming from an emotional place rather than a physiologic place?
Yes. Now, it's important to distinguish that when I say psychosomatic, most people, when they hear the word psychosomatic, they say, oh, it's imaginary pain, I'm crazy, it's I'm making it all up, it's all in my head. No. Mm-hmm. Psychosomatic means that the pain is real, but that the source is not physical. It's not structural. Mm-hmm. The source of the pain is psychosomatic. It's psychological.
It's psychological.
Yes.
Would you say, in your view, that all pain is emotional, comes from emotional place, so that people who are experiencing pain relevant to cancer or inflammatory illnesses, or like you have experienced yourself, back issues where you do have the inflammatory process going on, that all of this is stemming, all of the pain is stemming from an emotional place rather than a physiological place? Is that
no, I'm not saying that.
Okay.
It's important to, and it's such a great question. The pain that I'm talking about is chronic pain. So chronic pain that's been around over time is likely to be psychological. Things like cancer, things like tumors, things like of that nature, autoimmune diseases and things like that.
Yes.
They're kind of a hybrid. Mm-hmm. But the type of pain that I'm talking about, back pain, knee pain, shoulder pain, digestive disorders, acne, migraines, carpal tunnel syndrome, those types of things that everybody subscribes to being a structural, that the source of those things are structural or some kind of chemical imbalance, I'm saying that they're likely psychosomatic. But the only person that can say for sure would be a doctor.
Mm-hmm. So let me just go with your book that I have read. It is very interesting that you talk about the unconscious and the conscious. The unconscious, where we, like an iceberg, we bury a lot of things unconsciously, and we are not aware of what's buried deep in us. And sometimes it may manifest itself as pain.
Very good.
Pain.
Yes, yes.
Would you agree with that?
Yes. So there's a very specific relationship, as you're saying, between our unconscious emotions and the pain. So I just, to fine-tune what you're saying, It's not quite that it manifests itself as the pain. So that's one kind of relationship between the unconscious emotions and pain. And a lot of people, that's kind of like a lot of people talk about that. And I'm not saying it's not valid. I'm just saying that's not what I'm talking about in my book, and that's not what Dr. Sarno was speaking of. So instead of the pain being an expression of those repressed emotions, like, I have pain in my mouth, that means there's something that I'm not expressing, or I have a digestive, I can't, go to the bathroom, so there's something I'm holding on to. That's not what we're talking about here. That's a different relationship between our emotions and our pain. Mm-hmm. So the question is, so what is the relationship that Dr. Sarno is talking about, that I'm talking about in my book? The pain has a purpose, and the purpose of the pain is to distract your attention from those repressed emotions.
Okay.
So that really needs to get in there with people. If the pain exists to distract your attention from what it perceives to be dangerous or uncomfortable emotions that we, quote unquote, as good people shouldn't be having. So the pain wants you to look at, it distracts you 24 hours a day, 7 days a week. Look over here, pay attention to me, so that you're not looking at emotions such as uncomfortable emotions, or maybe even unpermissible emotions, such as hostility and rage towards loved ones, or your children, for example, or parents. Those are all hotbeds for emotions that we, quote unquote, shouldn't be having. And I'm mentioning all this because, so what's the solution? If you understand the relationship, the solution becomes clear. So if the relationship between the pain and the unconscious emotions is that the pain is designed so that you don't look at the unconscious emotions, the solution comes from looking at those emotions, not necessarily resolving, but just looking, accepting that they're there, being okay with having them. Mm-hmm. Then the pain no longer has a purpose and disappears.
Mm. So tell me, when you're talking about the pain kind of drowning out, if you will, the deeper self.
Distracting your attention from those things.
Distracting yourself from the deeper self.
Yes.
If I were to take maybe an analgesic.
Yes.
Or a prescribed medication, would that not give me that ability to see those emotions clearer? Or do you suggest that medications are not really necessary to get to that?
Yeah. Medications is that gray area that if you use them so that you can look there, that would be a smart use of those medications. But if you use them to further distract yourself, then whatever symptoms they might have suppressed or made go away, they'll appear in some other way so that you can continue to be distracted from those harmful emotions. Does that make sense?